Okay, my name is Dominique Hunt, and I am the lead dentist at Mint Dentistry in McKinney in Texas. And I have been practicing for 7.5 years. So I graduated from Loma Linda University School of Dentistry in 2013. And yeah, I worked in California and then also in Texas as well. So, yeah. I actually didn't know I wanted to be a dentist until my fourth year of college. Crazy. I took a sort of roundabout route of figuring out what I wanted to do. And so it took me 5 years to get through because I just couldn't decide. It could be indecisiveness or liking too many things. But I always knew that I wanted to be in the health field and to, be able to help people. I saw my parents, they were both physicians. And so they were able to help people in a very meaningful way. And I knew I didn't want to do that because of the lifestyle of always being on call. But I always knew that I wanted to help people. So it took me a little while to find the right path. And I really have always enjoyed working with my hands and fixing things and building things. So that's kind of what led me to dentistry. I actually probably never would have found dentistry, surprisingly, but my uncle, he was like, well, you like helping people and you want to work with your hands. So have you ever thought of looking into dentistry? And so I think my the beginning of my fourth year of college, I started shadowing a dentist, and then that's when I really started, planning to go that route. And so then my last 2 years were making sure that I fulfilled my requirements for dentistry. Normally, when I get to work, I check to see how many patients we have and what type of treatments we have. And then it's kind of off to the races from there. And this wouldn't necessarily be a typical day for all dentists. It just depends if you are working more in like a corporate setting or a private office, which I have done both. When I first graduated, I worked in more of a private office. So it was a little bit more slower paced. And, you see definitely one patient at a time. And then I, right now, I'm working for Mint Dentistry, which is still a privately owned company, but they have multiple locations, so it's definitely faster paced, bigger offices, and so then you'll have more than one dentist working at a time. Whereas my first couple of offices, I essentially worked by myself. So my day is really just running between rooms, and we see new patients. We have lots of new patients every day. And so that's just getting them ready for if they have treatment, getting them ready for the type of cleanings that they need, just letting them know how their mouth is doing if they haven't been to the dentist in a while. And then we have our other patients, which are our patients that are returning. So they've already been for their first appointments. And usually they're back in 6 months to do just follow ups and cleanings as well. And then we have our treatment patients. So they've had their first appointment with us, and then now they're coming back to start completing the work that they need, or they're coming in because they're in pain. And so we get a few of those every day, maybe five or six that are in pain. And so they may request treatment that same day. Or, if they have like an infection or something, then we give them antibiotics and then are going to have them come back afterwards, maybe like a week later once they finish their antibiotics to get the treatment done. It's always a little bit hard to work on patients that are in pain or have an infection because they don't get numb as well. So, um, but my day usually goes from 8 to about 5:36, depending on how those last few patients wrap up and if it's bigger treatment during the day. So um, I pretty much do everything. So that will include just regular dentistry, like fillings and crowns, which are little caps that go over the teeth. Um, and then we also do like root canals, which we're taking the nerve out of the tooth, and we do extractions as well, which is pulling the teeth. So any of that could come throughout the day. So after high school, typically it'll be 4 years of college and then 4 years of dental school. And after that, you can also do a residency, which is typically 1 year if you're going to be a general dentist. If you're going to go into a specialty, that can range from 2 to 4 years. So I did a little bit longer. I did 5 years in college because I didn't know what I wanted to do. And then I did 4 years of dental school. And then I was done with school. So I was like, I'm going to go work now. Every once in a while, you could possibly do it in 7 years. I know that there was a program where you could do 3 years of college, and then as long as you had all of your requirements, you could go to dental school after that. But I don't think they typically take students that do that. I only think we had one in our class that maybe didn't finish college and was able to go to dental school. So typically 8 years of formal schooling after high school. And to that point, we also had, some older students that had previous careers and they went back to school and did all of their requirements for dentistry. And then they, went into dental school. So once you complete college, as long as you're within the time requirements, you can still complete the prerequisites. And then as long as you take your DAT, which is the standardized test to, get into dental school, you can still go back and go to dentistry. So even if you had a previous career, if that sounds like something that's interesting, it's still something that would be feasible to do. I would say so. I think every life experience kind of gives you skills for the job that you end up with. Um, I mean, when I was probably 10, I was mowing lawns just to make money, I guess. My dad would help me and drive me around, and I would mow lawns. And so I think that probably just gave me a good work ethic where, I'm going to be there for the full day, giving 100%, and then not, not always calling out because at a young age, starting to work, that just, and then seeing my parents working so hard, that just kind of gives you motivation to always trying to take care of yourself, I think. And then, just, I don't know if it's necessarily jobs that influenced me, but like at work, my staff always says like, oh, you're the tech man, or oh, you're Mr. Fix It, because I don't really like calling people to come in and help us fix things. So I think just growing up with my dad always tried to fix things on his own, that came over to me. And then I've always been interested in computers. So I always try to figure out things first before calling somebody to help. Now, I'm not going to go and mess up something, but I try to take care of it on my own first. Now, with dentistry, I think just different job experiences have, like when I was in college, I was a tour guide for the school. So that probably helped me talk to people a little bit better, which I'm a shy person. So definitely needed that. That kind of pushed me out of my comfort zone. And so, yeah, I think definitely jobs in the past have helped me, be where I am today and have contributed to what I do now. I think first and foremost in dentistry, you need to be caring and just aware of other people's emotions and fears and body language and all of that, because which I didn't realize at first was that most people, I won't say everyone, most people are terrified of the dentist. And, if you don't have that awareness and caring nature, then it kind of just perpetuates the fear, essentially. So I think that's one of the biggest things. And then, just being gentle. And you don't really have to have these qualities, but I think that that is what can set you apart from other dentists. You could be a great dentist, like the best dentist in the world, but if you hurt your patients, and you're gonna still have patients because you're a great dentist, but it's not going to be an enjoyable experience. So I think besides like having great hand skills, and you can often be taught those things, having just a care for other people is something that's very important in dentistry. You will learn a lot of the techniques and everything in dental school, but I'll kind of just go through some of the stuff that we did in dental school to get us ready for working in dentistry. So my first year is a lot of classes, which was hard because it's like you forget you're in dental school. But one of the cool things that we did was when we got to our lab, we learned how to wax teeth. So we would get like a little pedestal with no tooth or half a tooth on it, and we would have to wax the other half and match a model. And so that was a lot of like the first semester of our first year. So you learn that, oh, you have to be a sculptor when you're a dentist, and you have to be very precise with measurements and sizes, because they are very particular about that. And then you learn later on that that's very important, because you have to be very precise in the mouth, and you have to hopefully make somebody's tooth look like a tooth again if it's half of it is gone, or things like that. So um, you know being very precise with measurements and being able to use materials was something that was very important in the beginning. And then you need to learn how to use a drill, um, or we call it a handpiece because drill doesn't sound very nice. And so, being able to cut very precisely and cut in different patterns, you learn that like your second year of dental school. And so that's probably your main instrument that you're going to be using throughout dentistry is your handpiece, because people's teeth they have cavities, and you have to take those cavities out and then put in new material to replace the tooth structure that you removed. So yeah, that's the handpiece is your main, or the drill is your main instrument of use in dentistry. You have other instruments like when you're doing extractions, you have something that looks like a screwdriver. We call it an elevator. You have something that looks like pliers. We call them forceps. So, you try to hide those from the patients because they look like screwdrivers and pliers, which is not very fun. Um, so you'll learn how to use the techniques for, taking a tooth out, hopefully without breaking it. And then if you do, you are using your drill to help you um, have places where you can push on the roots to remove the tooth. So those are the main things that you use. You have like I wear these magnifying glasses. They're called loupes, and so that it actually takes a little bit of practice to use as well, because you're used to your depth perception, and then all of a sudden everything is much closer to you. So that takes some practice as well. You have a light that you use that's over you, and so a lot of times you have to make sure that's positioned correctly so you can see in somebody's mouth because it's dark. And then when you're in dental school, you'll learn how to use all of the suctioning devices. So you have like a very powerful suction, and you have a less powerful one that the patient can close on, if they have built up a lot of water in their mouth. But then once you get done with school, you actually have an assistant who will help you with that. So that's kind of nice. In school, you have to do everything. Once you get out, you have people to help you, which helps to make things faster. So I think those are the main tools that we use in dentistry to help people. if you can be like a traveling dentist. Now in dentistry, your license mainly works for the state that you're in, unless you're going for a specific purpose. So you the main part of traveling would be like if you are going to be a temporary dentist at different offices, and they have companies that um, will hire you, and then you go to different offices as needed on an as needed basis. But typically, if you are going to travel like within a company, it's going to be, in a specific area. So driving distance most of the time. The only time you really travel, I would say, is if you want to do like CE courses or continuing education in other areas, and which is required, but a lot of times there are continuing education courses in your area, so you don't really have to travel too far. The company that I work for, they provide some continuing education, so it's usually within like 30 minutes to an hour away. But there are usually associations. There's an association over the whole country, and then you have member associations in your state and in your like district, and so they will oftentimes have continuing education. So really, travel is up to you, um, and it's more of if you want to. And or let's say you had a practice in a different location, then yes, you would travel. If you had branched out in your own practice and had them in different states, then yes, you would most likely travel unless you had your own home office. But those are not necessarily normal situations. And usually in those cases, it's owned by a more of a corporation when they have multiple practices in different states. It will definitely be an above average lifestyle. We definitely make six figures. And I would say not everybody does. It just depends on what type of practice you get into and how successful you are. But I would say, I believe I read the average is around 124,000, somewhere there. That's going to be an average, and that is going to differ state to state as well. So each state will have their own average, of what you could make as a dentist. So, but you could definitely have a good lifestyle, comfortable home, um, nicer cars. One other side to that, though, is that dental school is very expensive. So, depending on how you want to pay that off, you may not make as much in the first 10 years. Like if you did a standard repayment, you're probably going to be paying half of your salary towards that a month. And then if you do like more of an income based repayment, then you can spread that out a little bit longer. But you would still make, you know, people would say you still make great money. Like maybe research the area that you want to go to once you're done with dental school, or because, you know, different places have different costs of living, and so that can play a big role in, you could be making a lot of money but really not able to live the lifestyle that you want because of the area that you chose. So just know like what type of lifestyle that you want, and then try to match that with the area that you want to live in if you can. If not, try to find something similar, maybe that has a better cost of living, because even though we do make a lot of money, a lot of times we put a lot of bills on ourselves. And so it the the money that we make ends up going out very quickly. And so because you have, along with making a lot of money, you want to live up to that. And I would say maybe like in the first few years, just live like you did in school, because that can set you up in the future for making and being able to have the lifestyle that you want to have. So, don't go out of school right away and buy a house or buy, really expensive cars, because you still have your school debt that you have to pay for. And so you want to get yourself established and really in a good position. And that's especially if you ever want to open up your own office as well. You have to save quite a bit of money to do that. So um, just try to figure out, maybe now, maybe when you're finishing dental school, if you're going to go that route, what do you want to do? Do you want to be a specialist? That's very important to probably figure out in the beginning, maybe the first couple of years before you start working on people. Definitely shadow those specialties that maybe you may be interested in, and just try to really be in that environment. Definitely people think that dentistry is very expensive, which I agree, it is. It's pretty expensive, and you go to the doctor, and that's also very expensive. Now, a lot of times insurance will cover a lot more of medical procedures than dental procedures. So I think that's one area that it seems like dentistry is probably more expensive than medicine. um, so that's one stigma. You'll have people come in and they'll say, oh, my mouth is paying for your boat, or my mouth is paying for your Mercedes out there. And sometimes I joke and I'm like, oh no, I drive that Mazda. And but and then if they're really sarcastic, I'll be like, oh yeah, you're paying for my Tesla. But that you have to read your patient. But that's one stigma. And then a lot of people think you may be trying to find something in their mouth. That could be one stigma. But I think people can read the type of person that you are. So if you are more of an aggressive dentist, then you might get more of that stigma. If you are treating every little tiny thing that you see, if you are more conservative, then you may not get that stigma. But people will probably walk in with the thought that dentistry is expensive, you're trying to find something, and they are also terrified of you. So that definitely makes things harder when they come in terrified, and you have to spend time reassuring them that you're going to take good care of them, that you're going to be gentle with them. And yeah, so that can make things a little bit harder. I don't know if there's really any things that make it easier for us. I think it's more of a challenging, um, more of a challenging job in that sense. I didn't really know what I was getting into when I wanted to be a dentist. I just knew that I wanted to help people. So my personality is definitely I like to please. And so that was very hard in the beginning, to realize that, people come in and they say, I hate the dentist. And so that was hard on me at first because, like you didn't even give me a chance yet. And they're like, oh no, I don't hate you, but I just hate the dentist. So I was like, this is my profession. This is my life. I spend more time at the office than I do at home. So that was a little bit hard at first, but I changed my perspective where, my goal now is to those patients that come in hating the dentist, we want to change their idea, and the dentist isn't so bad. It's not fun. I understand that, but you leave and you're not hating the dentist anymore. So that's my goal. And if I can do that, if I can make people laugh during their appointment, if I can make them smile, if once they leave a very challenging procedure and they're like, that wasn't that bad, that's when I have succeeded in my goal of changing their mind, and they're not going to be terrified next time they come in to see me. And hopefully, if they go somewhere else, they're not going to be terrified there either. So that's kind of my goal in dentistry. I would say it's you know when somebody comes in and they are just totally embarrassed about their mouth, and then we work with them for like 6 months, or however long, or just change like one little thing and they start smiling again. That's definitely my favorite. Of course, the bigger cases are the most satisfying, but you'll even get the small case where somebody chipped their tooth in the front and they're like always talking like this and they don't want to smile anymore. And you fix that, and then they're just like, it it looks so real. It doesn't even look like anything happened. And I think that's definitely my favorite part. And then also just like encouraging my staff to be whoever they want to be, because a lot of times they feel like they're stuck in their situation. It may not be their first choice was. So it's also satisfying, although sad, to see like people move on and move like they never thought that they could do anything more, and then they actually go for it. And so, helping, just really helping people in general, um, that's that's the joy of it. Is when you can just see their smile and see them happy, and then they come back and they're like, yeah, it's still there and it looks great, and I've gotten so many compliments, and you've changed my life, and that's really cool. Well, you still have those people that you cannot please, and that's probably the hardest thing for me, is the ones where you bend over backwards and you do the best that you can. Bend the rules, not really bend the rules, but you're like, let's say sometimes somebody wants veneers, or which are like coverings for the teeth. They may not like something about their teeth, so they want to cover their teeth and make them look like a Hollywood smile. um, and so sometimes you do just like one of those in a particular area, and the patient wants you to send it back, and then you get a new one and they want you to send it back again, and they approve it, but then you put it on and they don't like it. And you know you have those people that want to talk to you for like 2 hours, and so that can be hard. I mean, I would say dentistry is a stressful job. Not to put it any other way. It's very, with it being very precise, and it can be very challenging at the same time. And it is a little bit of high stress, because you have to try to make people happy. You're working in a very small area, and you want to make sure that if you want to make sure that everything is correct, you think about everything that you did wrong, even if everything looks wonderful. Like, I still think about, oh, there was one little part that I didn't like of that tooth, and I think about that. It doesn't keep me up at night because I can sleep really well, but I like will stress about it the rest of the day. And when I wake up, I stress about it the next day, and like, did I do the right thing? Could I have done something differently? So it can, if you have that type of personality where you worry about like doing things perfectly. I think I'm a little bit of a perfectionist. So if you have that in you, which I think a lot of dentists are perfectionists as well, you will worry about a lot of things. And I think I have heard dentistry has a very high suicide rate, just because of the stress of the job of trying to please people, do things perfectly, and you do work really hard as well. So and I think a lot of people don't take the time because of maybe financial debt and things like that. You can't really take the time to recharge and go away and take a vacation unless you specifically plan for that. So those can be some of the challenges with dentistry. If I had been, I don't know how I would have known this, but just if I'd known that people didn't like the dentist, that may have changed my career choice. Um, and then I would say that I'm more of an introvert too. So sometimes talking to people for so long, I kind of wish that I was in a job where I didn't talk to people. Even though I like talking to people, sometimes I'm just like, okay, it's too much. I have to do this every day. I don't want to. But so like if you're an extrovert and you care about people, this is the job for you, definitely. But So I just need to recharge sometimes. But I think the biggest thing that I wish I had known was okay. So there's a couple that people didn't like the dentist because I guess I always had good dentists and good teeth. So I didn't know it was terrifying. And then I wish I had known dental school was so much, um, that it cost so much. So just to give a ballpark now, dental school runs between 300,000 and 500,000 for all 4 years. So that was a shock at the end when I found out, oh, this is how much my loan that I have to pay back is. Um, and then what was the other thing? Yeah, I think just like talking to people all the time, which is fine. But some days, I just want to go into a corner and just do my job and then go home. So those are probably the main things. It does take up a lot of personal time. I'm I would say I'm at work quite a bit. Probably not as much as a doctor because I'm not on call ever, at least in this scenario. If I had my own office, I would probably be on call, essentially 24/7. But I don't think you really have too many people calling you to in the middle of the night unless they're in terrible pain. But a lot of times they will go to the emergency room if something is going on. Now they might call you if you just did work on them and then something is feeling, really bad. But in the scenario that I work in, I don't really have on call times. Um, and I don't normally have to work on weekends except for in our busy season, which is usually December because everyone's insurance is going to renew. And so, um, yeah, I mean, the days are long, but I think in general, most people's days are long. So I do get a little bit of vacation time, but it's in this field, a lot of times it's not paid. So as the dentist, as staff members, you may have like paid time off, but a lot of times the dentist doesn't have paid time off because we do make good money. So they leave it up to your budgeting skills to take a vacation. I would say definitely shadow a dentist. That is going to be the best way. That's going to get you the closest to it, or you could become like a dental assistant and maybe do that part time to kind of get your hands wet, see if you even like working in somebody's mouth before. That's probably what I would have done is, become a dental assistant or a dental hygienist, and then um, see if this is something that, because I know a lot of dentists have gone to hygiene school and then they do dentistry after. Um, because you can complete hygiene in college. So you do like 2 years of college and then 2 years of hygiene school, and then you can start practicing as a hygienist. But assistant is much quicker. It depends on what state you're in, but it can be like 4 week program to 10-month program to do assisting school, and then you can get a better idea. So if you do an assistant, then you'll have all of your hours for applying for dental school. I didn't have that chance, so I just had to shadow dentists. I don't know how many hours it is now to get into dental school, but that's probably the best way. If I could have been an assistant beforehand, I would have seen a lot more of what goes on, and how scared people are and things like that, and been able to make a better decision as to what to do. So in our office, we have an office manager. They take care of really, in some offices, they take care of all of the business aspect of the office. They a smaller office will have just one front desk person, which is the office manager. So they take care of all of the phone calls, they check in all of the patients, they verify all of the insurance for patients, making sure that we accept their insurance. Um, and they also handle all of the finances and all of the staff, essentially HR issues. And then if you're in a larger office, you may have an office manager who mainly oversees all of the other employees. And so then you'll have a receptionist, you may have a schedule coordinator, you may have a specific insurance verifier in your office. So it really depends on the size of your office. That could all be in the office manager's job, or you could, it could be delegated if you have a very busy practice because they can't do all of those things. And then with the doctor, you'll have a hygienist who cleans people's teeth, and then you'll have assistants. And the number of assistants just depends on how many rooms you work out of at a time. So, you could have, let's say you have an office with 6 rooms, you may have 4 assistants and 2 hygienists who are going to be helping you bring patients back and seeing those patients. Usually for, let's say, a 1 doctor office, you may have 4 rooms, and then you'll have 1 or 2 hygienists, 1 or 2 assistants, an office manager, and a front desk receptionist. And so, maybe about eight staff members for a smaller office. I would just say, just try to go for what you're going to enjoy. I know everybody says that. And I mean, the main thing is just work hard. I know everybody, since I have my own staff, I really enjoy working with people who have the same work ethic as me. And so if you're working hard, we can still have fun, because I like to have fun, or else it's just work. And that's not necessarily the best thing. I mean, it's great to help people, but you still want to have a good time while you do it. So, we try to laugh while we're working on patients, and patients are sometimes cracking up while we're working on them. And they're like, sorry, I didn't mean to close there, but, just having a good time, working really hard, trying to be efficient with what you do, and just being truly genuine especially when you're looking for a job, just being genuine in who you are, and not trying to put on like you can do something that maybe you can't, because eventually they will probably find that out. And then, like, I thought you could do this. And so we've had a couple times where somebody said they could do certain things and they couldn't. And then you're stressing out because they can't do what you expected them to be able to do. So a lot of times that doesn't mean that we wouldn't want you to work for us. It's just, we know that we need to train you in that area. And if you have a great personality and you are true to who you are, that plays more, in my mind, that plays more of a strength, that you are honest with who you are, and that you can show how genuine you are as a person. Then that is what I look for. And everything else can be trained. When I first started, I wanted to be an orthodontist, and I had somebody talk me out of it. And I should have done more research on it and decided for myself what I wanted to do. Now, when I finished dental school, I didn't really want to do any more school anyways, but looking back now, I kind of wish I had done it, because I think it would have been fun. I did a little bit of that specialty as a general dentist. Oh, one thing I didn't mention was, as a general dentist, essentially you can do anything in dentistry. So you just need to make sure that you're well trained in that area. Specialists are going to mainly focus on the area that they specialize in, so you don't really do the other parts of dentistry. um, as well. So if you want to be a general dentist, but you like a certain area, you can always do that. You know, you can take the continuing education courses. They usually have special courses for general dentists in those areas, and you can do that. So you can work and you can work and you can take those courses as well, because they make them specialized for you as a general dentist, knowing that you're going to be working. So even if you don't get into the specialty that you want to do, you can still tailor your practice to what you like the most. So I know there are some general dentists, they mainly do orthodontics or braces because that's the area that they like, even though they're a general dentist, and they can still do other things if they wanted to. Whereas, like, an orthodontist isn't going to be doing fillings or root canals, even if they wanted to, because that's not the scope of their practice. So, um, even if you don't get to the place that you want to be exactly, you can still find a path to that. Just because our specialty is so broad, as a general dentist, you can do anything that you want, essentially, as long as you do it to a high standard and you want to do it as close to a specialist standard as possible.